We're going to begin our podcast with a wonderful joke. And that joke is...
A wonderful joke or a dad joke?
Yeah. It's dad. Definitely dad.
All right.
Because it's not a good one, but we'll at least get it started.
All right, I'm ready.
So, why did the tampon break up with the pad?
I don't know. Why, Dr. Scott?
Because it couldn't handle the pressure.
This is Stirrups, candid conversations in women's health. The podcast where we answer your burning questions and discuss the evolution of women's health through every stage of life. Join Dr. Randolph Scott and duly certified women's health nurse practitioner and certified nurse midwife, Kerry Autry, as they discuss the unique health concerns women face and share expert advice to assist you on your journey to maintaining your health and wellness. If you're looking for informative discussions, tips from qualified professionals, and a community dedicated to women's well-being, then you're in the right place.
Let's get on the topic of red alert. Heavy menstrual bleeding and what it means to have heavy bleeding and really how you take care of it, you know. For us, Kerry, I think oftentimes we will see patients and they don't even know a problem exists.
Agreed. You ask them questions and they just think like everything is fine. And then they start to talk a little bit more and you just kind of look at them like, oh my gosh, you poor thing.
Yeah,
like,
that's
this has been you your whole life?
Yeah. And so sometimes patients don't know it's a problem. Sometimes it's very intuitive, meaning you've had a nice change and that change brings about the aspect of inquiring about the health aspect. And so with that in mind for us, when we're talking about heavy bleeding, Kerry, how much is too much? What do you think about the aspect of when is it appropriate in terms of follow-up management?
Yeah. There are all kinds of definitions out there. If you Google this, it's going to give you all kinds of numbers about pads and days and whatever. For me, and I always tell patients, if you even considered asking your provider the question, if you even wondered if it was too much, it's probably too much and you should come in and talk to somebody about it because it could probably be helped significantly.
Yeah, I agree. Sometimes trying to figure that out can vary and differ because a lot of times patients have lived with it, their entire reproductive life and they don't know that it is problematic and you're going through the management of things and you're just kind of barely getting by. To that extent, if it's ever a question, the annual exam is a perfect time to bring it up to your provider and just see what they think and what their thoughts are and whether or not it requires any further follow-up or management. We can get really precise, though, about the aspect of the time.
Yeah.
Now, the volume is always a little bit of a question mark, but the time is something that's well-defined in terms of what we would consider to be excessive. And so if your cycle is really more than 7 days in duration, then oftentimes that's too long.
Right.
If you have a 10-day menstrual cycle, it's probably problematic in a variety of ways for you, and it requires some level of evaluation and workup for you. So the timing aspect is a little more precise for us. It kind of helps the patient in terms of guidelines. And, the length, I think is just as important as the volume aspect of things for you too. Because if you have long cycles, they tend to get longer as time persists. Not always guaranteed, but certainly that can be a challenge for some patients. And so often patients, once they figure out they have a problem, it's always upon the provider to really help figure out as to why. And the why can help you determine modes of treatments. But there are a variety of treatment options that are available. And so speaking to your provider about that certainly would warrant some evaluation if you meet some of those thresholds. Now, Kerry, what are some of the causes that you see that contribute to the heavy bleeding?
There are different causes at different stages of life very often. And of course, when we're talking about different stages of life, it's how we manage those things are going to change. Usually when it's younger women, it's something that we have to look at maybe adjusting hormonally. Usually we're looking at maybe considering some sort of hormonal birth control to adjust that. But as women are getting older, very often the cause is a little bit more mechanical. Very often we're talking about some fibroids or usually fibroids. Very often, but sometimes, and then as we get to much later in life, when we're looking at perimenopause, menopause, it is hormonal again, but the bleeding is still significant and really just has to be managed. And there are so many great tools out there to do that.
Yeah, I think those are all great reasons as to some of the heavy bleeding concerns that patients can have. But there are things like polyps, or which are, growths of tissue inside the uterus itself.
And those can be in very young women.
Yes, and those can occur at any stage of the game. Of course, there are the fibroids, and those are benign tumors that are within the muscle of the uterus itself, as opposed to the internal aspect of things. Sometimes cervical disease can be problematic and certainly cause some irregularity in terms of bleeding that patients would experience. Sometimes infection is a factor. And so you want to incorporate all of those into possibilities and have the management and evaluation before you consider the treatment aspect. And
you make a good point, though, because usually, sometimes we're talking about heavy bleeding that's just really during the cycle and very, very heavy. But sometimes people are having bleeding in between cycles. Yeah. That's just persistent, sometimes even throughout the cycle. And those tend to have different causes, usually more like cervical or infection or something like that. But even if your period is reasonable, but you're bleeding throughout the cycle, that still should bring you in to ask some questions, because that can usually be managed very easily as well.
And speaking of management, I think from a management standpoint, there's a lot at your disposal. Something as simple as ibuprofen can be helpful in terms of management, the pain that you may have, but also perhaps the volume in your cycles. Birth control pills. There's a patch, a ring, a shot, medication. And of course, the IUDs, which we spoke about in our previous podcast. Some patients are having things that are more of a permanent solution, like the aspect of an embolization, or an ablation. Some patients are having what's called a DNC hysteroscopy, which is where you kind of clear the lining of the uterus out and take a look. And even for some of our patients, that their bleeding has been such a horrible experience that they are actually considering taking the uterus out itself, and that's the hysterectomy. So there's a variety of things that work, and the right choice for you would be dictated between the conversation of the patient and the provider. I think for us, we wanted to focus more so on the aspect of the ablation.
I was going to say, so many people come in, especially when we're talking about after they're done having kids and their periods are so horrific. Yeah. And they come in terrified because they think that if they say something, the only answer is a hysterectomy, right, which is a really scary word. Yeah. And there are so many things that are short of a hysterectomy, but equally as effective in managing the bleeding while still maintaining the pelvic architecture. Yeah. So if you could, you mentioned a couple in there that I think are great options that people have no idea about. And it's really funny, like when I talk about them with patients, like you can see their eyes get really big. Like there's some management option that doesn't involve taking out my uterus.
Yeah. Great experience in terms of other opportunities. And that's why we're focusing, because I think a lot of people know about pills. Dime a dozen. And people know about, all right, let's take the uterus out. But what is that in-between thing?
Right.
What is that?
Right.
And how can that be helpful for me? And who is a good candidate for that? And so you alluded to some of that. And so we're talking about the ablation, which is a process where the lining, specifically just the lining of the uterus. Now, we're not burning down the house, okay? It's not the entire thing, but it's certainly the lining of the uterus that can be helpful for patients. But who's a good candidate for the ablation?
So the biggest one is really if you're done having kids. If you're past the age and you've had all the babies that you want to have, it can be an incredible tool for those women.
I would agree. The only criteria that is met with the aspect of the ablation is that you want to be past the point of which you want to have kids. And to speak to that is that if you are at a point in your life where you've never had kids, but you are certainly having some trouble bleeding, it's still an option for you. Okay. So it's the aspect of having children is not a prerequisite to have the ablation. And so that is far from it. It's really the patient that is really tired about the amount of bleeding that they're having. They're oftentimes anemic as a result of the bleeding that they're having. And you have firmly made the 100% decision that you don't want to have children. And the reason is because once the ablation is done, it's considered to be a permanent solution. It's not something that's reversible or that you can take back. And once that lining is disrupted, it makes it inhospitable for a pregnancy. And if a pregnancy were to occur, it would be certainly a high risk. So the decision needs to be made that, hey, I'm at the point in life where either A, I never want to have children, or I've had all the babies that I ever want to have, and we're ready to move forward with something of a more permanent nature.
Right. But I think the amazing thing about it is that, for people who are in this space, it's also become, you mentioned anemia, which is important that now your blood counts are low because you've just lost so much blood over so many months. But it's also such a quality of life issue for these women. They can't go to work 3 days out of their cycle because they just can't be away from their bathrooms for 3 days of their cycle. They're spending a small fortune in period products every month. It has become, for so many of these women that I talk to, a point where they are really just totally out of the game for 3 to 7 days out of the month. And I tell patients all the time, we just can't afford to not have you in the world for 3 to 7 days out of the month. Forget the fact that you just don't deserve to be stuck at home for 3 to 5 days out of the month. So, when you offer them something like this ablation, it is really life-changing for people who are good candidates for it.
You're right. I hear the stories. You hear the stories.
Yeah.
Some women are carrying a second pair of clothes in their car because they're afraid to have an accident someplace. And that's just dreadful to, live your life knowing that my life is in a bag, And so I think it can be a very helpful tool to bring that life back. And it makes a lot of people happy in that regard because when you're bleeding heavily, you're not feeling well.
Yeah.
And most people, when they're not feeling well, that kind of leads into, being cranky.
Yeah, absolutely.
And so, I think from the aspect of some semblance of giving your life back, I think the ablation is a great tool to actually meet that need for you. So with that in mind for us, questions, that we get in terms of the ablation, we answered who is a good candidate. We think about the ablation in this total sense because it is oftentimes an office procedure, sometimes not. Not everybody is suitable for the aspect of the office procedure. And so from a benefit standpoint, what would you counsel your patients about the benefits of the ablation if they were to get it?
So I'm usually focused on that quality of life. This is most often, even if not done in the office, it's most often an outpatient procedure. Yep. It is, in terms of invasive procedures, on the lower end of invasiveness. Really important that they're not going to leave with a number of incisions. There's no incisions. So you're not going to have wound care afterwards. And if you can give us the day that you would need for the procedure, plus maybe a week or 2 for recovery, you can have your life back. Are there risks? Of course, and those risks have to be talked about and taken seriously. But for most people, this procedure is, 2 weeks out of their lives, and they get their lives back in a way that they haven't had for a lot of patients in years.
Yeah, and the 2 weeks is the long end.
That's being really generous.
That's being really generous.
That's me giving you as much time off of work as I can.
Yeah, that's right. I have done ablations where if I do it on a Friday, by Monday they're going back to work, skipping around. Yeah, they're like, oh my gosh. The reason why the ablation is effective It's two reasons. It's twofold. You go through a process where immediately it will take care of any bleeding concerns. And so I get some patients that will say, oh my gosh, I'm gonna have to cancel my procedure because I'm on my cycle. No, that's what we're trying to do.
If we were trying to schedule around that, we'd be in trouble. Yeah. That's why we're here.
Well, this is what we're doing. This is what we do.
That's true with everything we do, though. How often do we get that phone call? We can't come in because we're bleeding. No, come on in. You're not gonna shock us, I promise.
So to that extent, if it's actually performed on the cycle, no problem at all. And for some of our patients, it's good to actually have an immediate end to that particular aspect. But the twofold effect is it is a burning process that takes place. The secondary effect is one that really creates that permanence, is where scar tissue from the lining of the uterus actually builds. It's almost like having a burn on your skin. I mean, we've all been burned on our skin. And it takes place in a very similar process where it goes through a weeping circumstance, then a scab forms, and then you're left with that white shield that's placed. That's the same thing that takes place internally for patients in terms of the ablation. And that is what provides the long-term effect that you can have from the ablation. And so because it has a long-term effect, again, I think it's a great way to manage some of that bleeding. The effectiveness of it is very close to almost having a hysterectomy. And oftentimes I will say to patients, I can't guarantee you that this is going to solve your bleeding needs, but I'm 90% sure.
And it's probably going to be better.
Yeah.
Even if you still have some bleeding, it won't be like it was before.
That's right. It's going to be better 90% of the time. And so somewhere in the ballpark of about 40% of patients will stop having bleeding altogether.
Right.
And we call that amenorrhea. So some patients have the aspect of no periods at all. 50% of the patients will experience lighter flow than what they were experiencing before. And it's vastly different for patients before and afterwards. Only about 5 to 10% of patients do they come back and say, Dr. Scott, that was snake oil. That didn't work at all for me. What else you got for me? So to that extent, there are some other options. It's not right for everyone, but effectiveness is certainly.
But I was going to say, to get that last 10%, I think there's like another tool, right? There's another option to get to that last 10% so that we don't leave those 10% of women with still having some bleeding. Because I know you've told me about it.
Yeah. And to cover that gap, oftentimes having an IUD placed at the time of your ablation can be very helpful. Right. Now, that's certainly an off-label use in terms of IUD, but the IUD certainly is recommended for patients who are having heavy bleeding concerns.
Absolutely.
And with the ablation, when it's done in the office, oftentimes providers will make sure that the patient is under anesthesia. So it's a great time to have an IUD placed because hey, you're asleep.
You're always like, it sounded like a great idea, but I just don't want to have one put in. That is the time to do it.
Right, exactly. So if you're making considerations for pain prospects, that is the moment of truth for you. And so it can be a great time in terms of that. And we touched on the aspect of, future fertility. Of course, it does impact the future fertility aspect because you disrupt the lining of the uterus. From a dad standpoint, sometimes it is a very, very touchy subject when we're talking about heavy bleeding.
You're kidding. We're always so easygoing.
Yeah, exactly. And for the partner to even suggest that this is a problem can be also a problem. So sometimes from a dad standpoint, you're just hiding in the corner because mom is on a rampage and you just don't understand why, but she's going through this moment and period of time where she's having some heavy bleeding circumstances. So I think one way is to certainly be empathetic about what she's going through and the challenges that she faces during this particular time.
Right.
And so it's the recognition that is helpful. Like, honey, I understand what you're going through. Can I get the groceries if that's something that the dad doesn't do? Yeah. Something that's kind of out of routine in terms of that. And then encouraging, saying, hey, I was listening to this great podcast, by the way, and let me tell you, you've been bleeding for more than a week, so I know it's a problem. That's what they said. And so I think you might need to have this checked out. And so, increasing your fund of knowledge, but also being very empathetic about what your particular partner is going through, and encourage them to find perhaps another way. And that's what we're here for. I often get the question, does an ablation cause menopause?
That's
hoping so. That's the goal. That is the goal. By pure definition, menopause means that you have not had a cycle for a year.
Right.
So if I can get you there, then it has worked. Now, the other aspect of it is that the ablation affects hormone levels. How much, Kerry?
Not at all.
Not at all.
Not a bit.
Zero.
So when people think about menopause and they're terrified of hot flashes and night sweats and mood swings and all the things that we associate with it, an ablation, well, it will stop your bleeding. It's not going to lead to that. Now, that was going to happen at some point anyways for most women, and it will still happen, but it'll happen when it was going to happen anyways.
Correct.
But you'll still have like years of no bleeding up till that point. So you get like all the benefits of menopause without the downside of menopause.
Right.
We'll cross that bridge when they get there.
Right. We can help with that too.
We can.
But that's another topic, another day. So it does not impact hormone levels in any way, shape, or form. And so to that extent, it's a very helpful tool. It's one that I strongly recommend for a lot of patients once they've decided fertility is not an issue. And going forward from there, I think it's good for us to touch on some of the superstitions that surround your heavy cycle. And so I'll let Kerry, you have a run at it, some of these.
Yeah, so there are crazy superstitions from all over the world about women on their periods. There are some places where they think that you are just more clumsy if you're on your period. Who knew? I'm clumsy all the time, so I don't really know. I can blame my period.
You can't blame it. You can't blame it on that. Yeah,
it's kind of like the forgetfulness. I just blame it. Like whatever's useful at the time.
Yeah, that's the dad in me too. I tend to not have a great memory, and so I can't blame the aspect of the heavy cycles being a problem in terms of balance. Now, I will say to some extent, if you're severely anemic,
that's true. If you're one of the people that we're talking about, right?
That could be a factor, but no, it shouldn't make you any more clumsy.
Well, I guess in terms of that superstition, then, if you're finding you're more clumsy on your period, you probably need to see us because you're probably bleeding too much. Shouldn't be true.
All right. So don't go swimming because of the sharks.
Yeah, I've heard that too. So apparently
that's a little head scratcher there. Now, supposedly the sharks can detect a drop of blood, a million miles away kind of deal for you. But usually we don't find patients, doing a whole lot of swimming during that time just because of the sanitary products that it requires. And so, certainly going to the beach at the time is still very,
you should
very
still
acceptable.
Go to the beach.
Yes, be very acceptable.
You have to book those way out in advance.
Yeah, right. Can't cancel your plan based upon some sharks. What? Okay.
No. And if you're thinking about canceling your plans based on your period, again, we're back to the same place. Like you're probably bleeding too much. We need to talk.
Okay.
Oh, I thought this one was funny. I'd never heard this before. If you shower with hot water during your period, it will be heavier and more painful. So I guess you just are supposed to take a cold shower for like 5 days out of the month? That sounds awful. I mean,
let me tell you.
My hair would probably be happier. But.
Well, okay. My kids, they laugh at me all the time because I don't go to the, when I go to the beach, I don't get into the water because it's too cold.
Because sharks?
Because sharks. Yeah. I'm scared about that. However, what they don't know is that Caribbean water, I'll swim in that all day. So it might be something to that, is all I'm trying to say. No. Hot water shouldn't necessarily be problematic, increase your flow.
If anything, hot water can be very
soothing, kind of get you through your particular experience. So I would encourage a warm shower for you in that regard. And so with that in mind, I think that covers pretty much what we wanted to cover in terms of bleeding circumstances, and certainly focus on the aspect of the ablation as a tool to help manage some of those things.
One more thing, though, we did want to talk about women who have not decided that they're done having children, but are still having heavy bleeding, because there are some tools out there as well. Sure. And I think the biggest one that we usually recommend is the IUD, because I don't know about you, but I think probably of the IUDs I place, and I place a lot of IUDs, probably only about 60% of them are for contraception. I bet about 40% of the IUDs I place are really for bleeding. So if you're in that space where you're having this heavy bleeding, but not done having children, that doesn't mean that there's nothing out there for you. Sure. You should still go in and talk to your provider, because there are still tools out there.
Yeah, I think that's one of our tools in our repertoire. One of which I would consider to be first line, in the sense that, of course, there are other options, but this is a really good way to manage things outside of taking a pill every single day, or a patch that you have to put on your skin, and adhesive that comes along with that, or the cumbersomeness of having a heavy cycle and then placing a ring vaginally, or, the other aspect of for some patients, iron therapy. You're taking iron, and iron is like a boulder. What is it going to do?
Oh, God, it's awful.
Yeah.
You're going to end up with all kinds of tummy troubles, constipation.
Yeah,
and
there we go.
Iron is tough. But I mean, the threat is real. Like, I have many patients that I refer for iron transfusions,
right,
because their bleeding has been so heavy for so long that now they're so depleted that we can't even replace it by putting them on a pill. So the health, the health effects, or the health detractors of heavy, long periods are real.
So even the treatment sometimes can even be problematic for some patients, but as you were saying, Kerry, the IUD, the ablation, and other methods are great ways to address that, and I think we've given adequate coverage there too. And so that ends our information session regarding to management treatment of heavy bleeding, with a little bit of a focus on the ablation and the IUDs. And so hopefully you guys found this informative and enjoyed.
Thank you for joining us on this episode of STIRRUPS. Be sure to send us your women's health questions and topics you'd like to cover by visiting our website, CarolinaEliteWomen.com. If you enjoyed today's episode, please subscribe to the podcast and spread the word by sharing it. To find out more information about Carolina Elite Women's Care, visit CarolinaEliteWomen.com. This podcast is edited and produced by Earfluence. Stay healthy and stay empowered. We'll talk to you soon on STIRRUPS.